Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Before we jump into today's podcast episode, this is just your weekly reminder to make sure that you are subscribed to the podcast on whatever podcast platform you like to listen on. And if you have not already, while you are there subscribing, make sure you leave a like or a comment or a review or whatever it is you are called to want to leave. Thank you so much. It really, really helps the podcast be found by other like-minded people who benefit from the information as well. So today we are going to be talking about shin splints. And before we dive into it in a lot of detail, I want to really clarify what it is that we're talking about, because shin splints is something that you'll hear dancers talk about quite often, and any sort of pain basically between the knee and the ankle often gets termed shin splints. But that is kind of a little bit of a misnomer. It's a term that gets thrown around a lot, but is not necessarily always talking about the same thing. So what I am going to be talking about today is specifically talking about medial tibial stress syndrome, or sometimes just called MTSS. And that is in reality, like what shin splints actually is, but there are all sorts of other things that can be happening in that region of the shin that people will often kind of throw out the term shin splints for, but it's maybe not actually the most anatomically sort of correct terminology. So just for clarity's sake, because again, I think it's really important that we really understand what it is we're talking about. When I am using the term shin splints today, I'm very specifically talking about that medial tibial stress syndrome. Other common things that we will see that maybe sometimes get misdiagnosed, or other sort of potentially common differential diagnoses for shin splints, are tibial stress fractures. And I'll talk a teeny bit more about those because they can be related to this medial tibial stress syndrome. But that's not what we're talking about today, is tibial stress fractures. But that's one thing that we definitely want to make sure that we're ruling out. If people have shin pain, we want to be able to differentiate between a tibial stress fracture and what we would kind of call quote unquote shin splints. And the other thing that often kind of gets thrown in and confused in this area is something that's called compartment syndrome, and most specifically anterior compartment syndrome. So that's like the compartment of the lower leg in the front of the leg, so the anterior part of the leg. And that is a completely different issue as well. And I may actually do a podcast episode on compartment syndrome in the future. But just to be clear, that is not what we're talking about today. So I'm going to use the word shin splints because that is what people are familiar with, and that is, the term that gets thrown around a lot. But what we are very specifically talking about is medial tibial stress syndrome. And what that is, or what shin splints are, is pain along the inner portion of the tibia bone. So that's the main bone of your lower leg. And so the pain in true shin splints is along the inner edge of that bone. So we call it the medial side of the bone, but it's the inner edge of that bone. We do get a lot of dancers who get pain and discomfort more along the outer edge of their shin, and that is more often than not related to the tibialis anterior muscle. And again, I'm not really going to touch on that tons today, but that is sort of a little bit of a separate problem. So in true shin splints, what we are talking about is pain along the inner border of the shin bone, or the tibia bone. It is most often from repeated stress to the area. And in the case of dance, it's quite common in dancers. And in the case of dance, it's from that repeated impact that we've talked about lots on the podcast before. So repeated impact landings, jump landings, things like that. The other population where shin splints is very common is in runners. And again, it's like that repeated foot strike, the repeated impact of the nature of that activity. And what happens is the connective tissues, or the soft tissues in and around that area of the inner shin, start to get stressed, let's say. They get a little bit overworked, they get a little bit irritated, and where they attach to the inner border of that tibia starts to become irritated, or in some cases starts to become inflamed in those areas. And so we get this pain and irritation along the inner border of the shin where the soft tissues and the connective tissues attach to the edge of the bone in through there. That is why it is really important to try and differentiate this from a tibial stress fracture, because what can start out as just irritation along the insertion of that bone, if we don't address the problem or people continue to train on it and maybe not address the biomechanics of what's causing the issue, these can, in some cases, progress to tibial stress fractures. And so, like I said, they're not the same thing, but they are closely related to each other, or can be closely related to each other. So we do really want to make sure that people are addressing these issues and getting it checked out and making sure that we're not kind of heading into that territory of potentially a stress fracture. If you are interested in learning more about stress fractures, there is a podcast episode specifically on stress fractures, kind of more generally about them, not specifically about tibial stress fractures, although I do touch on those ones in the episode. So I will link that episode in the show notes for you if you're curious a little bit more about the kind of pathophysiology of stress fractures themselves. So, what causes shin splints, or what makes people more susceptible to shin splints? The number one thing we see, and the number one thing I see in dancers in general, but we also see it in runners and other sports, is sudden increases in training load, and especially sudden increases in that impact training load. So it is very, very, very common. The two most common times that I see a lot of shin splint complaints are at the very beginning of a season. So people have had potentially like the summer off, or they haven't been dancing as much and had a bit of an off season. And then they jump right back into super high levels of training loads, like dancing, 15, 20 or more hours per week. So that is one time where it is very, very common that people will often complain about shin splint type symptoms. And the other time I see them a lot is dancers participating in summer intensive. So kind of by the time this episode gets released, we're going to be like right at the time where a lot of people are probably going into summer intensives. And depending on what your usual training schedule is like, and then what summer intensive you're at and what their schedules are like, that can often be a really, again, sudden increase in how much training load there is, or especially how much impact load there is. We will sometimes see increases in shin splints too, depending on what repertoire dancers are working on. So if you all of a sudden have a piece of choreography that has like really fast, intricate footwork with like a lot of jumps and a lot of like really fast transitions and stuff, that could be something that really stirs it up when you're maybe used to doing choreography that's maybe a little bit less jumping or less intricate in terms of the footwork. So sudden increases in impact loading is like the number one thing that we see in terms of like risk factors or causation for shin splints. Another thing that we see in terms of like actual, like in individual dancers looking at their anatomy or their structure, is dancers who have really high arches and specifically very rigid high arched feet tend to be more susceptible to shin splints. And in dance, that is often like a desired aesthetic. The people who have those really nicely high arched feet it's often kind of like sought after. But the downfall to having that foot structure is that it often does not work as well in a shock absorbing capacity. And if our foot is not absorbing shock as well as it should, all of that impact force gets transmitted up into the inner shin bone area and can lead to shin splint type symptoms. So although aesthetically that really high arched foot maybe looks really nice, it can functionally cause some issues in some cases. So that is often a dancer profile that we do see shin splints in, is the dancers with that really kind of more rigid, or sometimes it gets referred to as a more supinated foot position. The other kind of type of dancer who we maybe will see shin splints in as well is dancers who naturally tend to pronate or roll in a little bit more. And this may or may not be associated with having a flatter arch. I think there's a perception that people with flat arches are always going to get shin splints more easily, but that is not necessarily true, because we can have a dancer who has a flatter arch, but they have really, really good functional control of their foot, and then they will potentially never have any issues with this. But what I'm talking about is dancers who maybe aren't controlling their medial arch or their inner arch super well, so their foot's rolling in. And these are often dancers who, especially when they were little, they get corrected on this a lot. And so they learn to lift their arch by using the muscles that like kind of wrap around the inner ankle bone and go up the inner part of the tibia bone or of the shin. And that muscle gets a little bit overworked because it is one of the main stabilizers or main controls of the inner arch of our foot, but it also needs to work a little bit in a shock absorbing capacity. And if it's getting overworked by trying to like really correct and lift that arch, then it can start to get irritated and cause these shin splint type symptoms in through there. And in those dancers, well, I'm going to talk a little bit about it more when we talk about treatment, but in those dancers, it's often looking higher up the chain, so even up to the hip, in terms of how do we offload the foot a little bit and teach them to control from another area. So those are sort of the two profiles of dancers who we will sometimes see commonly developing shin splint type symptoms in through there. And then in the research, there's some thought, and this is maybe a little bit like older research, we'll say, there is some thought that people who have tighter calf muscles or shorter Achilles tendons are potentially more susceptible to developing shin splints. Clinically, I have not found this to be true. And when I actually kind of went a little bit deeper into the research, a lot of this research is quite old. Some of it is from like that running population, and it really doesn't actually seem to hold true per se. What I will say is, if people are a little bit tighter in their calves and their Achilles and it's affecting their jump landing technique, then potentially that could contribute to a shin splint. But simply having maybe a little bit of a tighter calf or a shorter Achilles on its own, from my clinical experience, I would not say is highly correlated with developing shin splints. And I don't think the research any longer supports that either. So just in terms of that jumping technique, again, there have been some studies, and by some I mean at least one that I know of, but again, it's not a super recent study, that looked at, because they kind of hypothesized that dancers who didn't put their heels down when they were jumping were potentially more likely to develop shin splint symptoms. But what they actually found in the study, and it was quite interesting, is it wasn't dancers who didn't put their heels down, but it was dancers who exhibited what they call like a double heel strike. And especially if you're a dance teacher, you'll be familiar with this, where what happens is the dancer lands from a jump and their heel goes down, but then it pops off again and then goes back down before they take off for the next jump. So it's kind of this, it's like a rebound jump almost. So it like touches and then comes off and then touches again before they take off. And dancers who do that, who have that like kind of double heel strike, they are potentially going to be more susceptible to developing shin splint symptoms. And then again, it was hypothesized like maybe it's from having a tight Achilles, but more than likely it actually probably has more to do with motor control on those landings and like being able to actually control and decelerate well on those landings than it has anything to do with like the actual length of somebody's Achilles tendon in through there. So just interesting kind of thoughts about technique with landing from jumps. There's not definitive research to say for sure if you don't put your heels down, you're developing shin splints, but definitely that little double heel strike or rebound in landing is something for teachers to keep an eye on and to be aware of, or dancers yourselves if you're like, being more aware of how your landing technique is, because that can potentially be a bit of a contributor. So, in terms of treatment, what do we do about about shin splints. The number one thing, because like I said, the number one reason dancers get shin splints is from these like sudden changes in training loads, or especially sudden increases in training load. So the number one thing we want to do is work on training load management. And so that does not necessarily mean like dancers can't train at higher loads, but we just want to avoid sudden spikes in that. So again, at the beginning of the year, if we have dancers who have been off in the summer, we know they're returning to dance, that first 4 to 6 weeks back to dance should be treated like their preseason. It should be a gradual reintroduction to the amount of training they're doing, and then also like the intensity of the training. And really amount wise, we don't always have a lot of control because the dancers are often at the studio for a set amount of hours in a week, but we absolutely can control the training intensity or the training load. And so what that might look like in this instance is really gradually reintroducing how much jumping they're doing. First week back at class, I would be doing very minimal jumping for these dancers. Maybe a few exercises just to start to get them back into it. But we don't necessarily want to be running classes where the entire class is across the floor leaps combinations and things like that, where there's a lot of really high impact landing. And then gradually over those 4 to 6 weeks, we are increasing how much impact loading they're doing. So it's not always just like, oh, they need to do less. Often it's just like how we're introducing the training load to them to avoid these sudden spikes or sudden changes in training load. For dancers who are already experiencing shin splint symptoms, we may need to modify that load. So for those individual dancers, it may actually mean pulling back on some of the impact loading, especially if what we see really commonly is I see dancers right at the end of September or the beginning of October is usually when they end up coming to the clinic with like shin splint symptoms. And so during that time, they've usually not had a gradual return to dance. They've usually gone back to the studio and like pretty much full out right from day one. And so 3, 4, 5 weeks into the season, they start to develop these shin splint symptoms. And so at that point, we probably do need to modify their training load slightly just while they address the issue. And then, once it's calmed down, then they can get back to full training load. So number one thing, modifying training loads or avoiding those sudden increases in training loads. Number 2, and this one's interesting, but cryotherapy has actually had good evidence. And so cryotherapy is icing, essentially. And if you've listened to any of the other podcast episodes or follow me on social media, you'll know that we have changed the protocols that we use for injury management in terms of like especially first aid, but just injury management in general, where we used to always use these RICE protocols or ICE protocols. So that involved the, rest, ice, compression, elevation was what that acronym stood for. And that's been replaced by the peace and love protocol. And again, I've done a podcast episode on that if you're interested in it. And in that protocol, we don't use ice anymore for acute injuries, like in acute injury management. However, shin splints are generally not an acute injury. They are very much an overuse or a loading mismanagement injury. And cryotherapy in these cases has actually been shown to improve people's symptoms over and above. Like they've done studies where they've compared it to using instrument-assisted soft tissue mobilization and myofascial release type techniques and things like that. And they've actually found the cryotherapy to be more effective. So this is an instance, and again, it's not an acute injury, but this is an instance where maybe using cryotherapy or using ice actually does help to decrease the inflammation or the irritation along that inner shin bone. So something to consider just because, like I said, the research is actually kind of interesting. Previously, there was a lot of emphasis that was placed on stretching, especially the calf muscles. And again, this was like, there was that thought that people develop shin splints because their calves or their Achilles were tight. And so a lot of treatment plans were all about stretching, but there's actually no evidence to show that that has any difference in people's symptoms. And probably because it maybe turns out that actually having a tighter calf or a shorter Achilles is not causative for shin splints. So stretching is not necessarily something that we spend a lot of time on. Certainly in individual cases, there may be a place for stretching out a specific muscle or specific soft tissue. But overall, the idea of like, oh, you just need to like stretch your calves like crazy and that's going to improve the shin splints is likely not totally accurate. Where am I going to go next? Okay, because we were just talking about stretching, we'll talk about strengthening. So strength is definitely something that we want to look at. And in some cases, it's going to be strength in the actual foot itself, and specifically in the intrinsic muscles in the foot to allow the foot to be better positioned to act in its shock absorbing capacity. And so we want to look at like how well does that dancer actually absorb shock and dissipate forces through the foot. So when we're talking about strengthening, we're very much looking at like foot strengthening, not so much calf strengthening, foot strengthening, and specifically intrinsic muscles. The bigger area that, like I said previously, I tend to look up the chain a little bit more is in these dancers who are maybe overworking some of those muscles, and specifically the tibialis posterior, as a way of stabilizing their inner arch and trying to prevent themselves from rolling in. In those cases, what we actually need to do is look higher up the chain to their hip complex and the control through the hip, and whether they're activating their hip rotators and their hip stabilizers to actually start to control the foot position from higher up the chain. Because if that's not being controlled well, and then they're trying to only control that rolling or pronation from the foot itself, that is a recipe for those muscles getting overworked and then getting irritated and inflamed and all of that. So when we're looking at strengthening, I'm not really specifically looking at shin or calf strengthening or anything like that. It is looking at more at foot strengthening, foot control, shock absorption through the foot, and then control and strength through the hip, and specifically in those lateral hip stabilizers and hip rotators in through there. We also really need to look at mechanics of the foot. So this kind of goes hand in hand with looking at the kind of strength or the function of how well they can absorb shock, especially in those dancers who have that higher, potentially more rigid foot. There are often areas within the foot where they are maybe lacking mobility, and the midfoot is a very common area. So a lot of the times what we're actually working on is improving the mechanics or the mobility of the joints in specific areas of the foot. And it's not always the midfoot, but I would say that that's the most common area. Sometimes it's like the hindfoot, less commonly the forefoot, but looking at the mechanics through the foot complex, because again, if the mechanics aren't working properly, the foot's not going to work as a shock absorber, and no amount of, strengthening the intrinsic muscles is going to change that if we don't have good mechanics happening through the foot. So really looking at that. When I treat dancers with shin splints, I spend much more time working on their feet and addressing issues within their foot than we ever do with the actual shin itself, just because of where the causes and stuff come from. So definitely looking at addressing foot mechanics. And then the final thing that is often a really big piece of the treatment plan for shin splints is looking at supporting the foot in some way. And so again, depending on what type of foot a dancer has, whether it's that rigid high arch, whether it's maybe a more mobile pronating foot, whatever it is, we often will look at using some sort of external support for the foot just to offload it while they're dealing with the symptomatic shin splints. So that could be a shoe insert, like an off-the-shelf orthotic type insert, or more often than not, I also will use taping a lot of the time. If we can just tape the foot to give it a little bit more support, offloads the muscles a bit and just allows the foot to function more optimally, so there's less force being transmitted through to the shin, that can be really, really, really beneficial. So a shoe insert, taping, or the other option too is definitely using some sort of a compression sock. If you have listened to the podcast episode that I did with Bree from Apala, the compression sock company, we talk a lot about this and how the compression socks have the ability to help with absorbing some of that impact load in through the foot. And so this is something, especially if it's a dancer who we know is susceptible to having shin splints, this is something we'll often recommend, especially if they're going into an intensive training period or they're coming back into dance after having a rest period or a period of time off. If we know that, at the beginning of every season, they deal with shin splints for like 6 weeks until their body gets used to the training load, and then they're usually like fine for the rest of the year. Something like using an external support and a compression sock is a really great way of doing this, is really beneficial just to try and lessen the impact through the soft tissues in that area. So those are the things to consider when we are looking at shin splints and how we treat them and how we deal with them as dancers. But like I said, number one cause we see is the sudden spikes in training load and specifically impact loading. And then in terms of treatment, that is like the number one thing we're looking at as well, is how can we kind of modify these training loads a little bit. The other thing to consider that I didn't really add into this is we will sometimes see shin splints develop in dancers who they might be like coping totally fine with their actual training load, but then they are working on cross-training or conditioning outside of the studio, and they'll add impact type activities. So say like running as their cardio cross-training. And so that spike in training load or that spike in impact might just kind of like set them over the edge. So sometimes it's not dance itself that is the problem. It's them trying to then incorporate something else. And in those cases, sometimes it's quite an easy fix, because if we can switch their cardio activity to something that's lower impact, like cycling or even like an elliptical machine or rowing or something like that, it often solves the problem if they were coping well with the impact load from dance previously, and it's just this like extra added impact from a cross-training activity or something like that. So something to consider, because I've definitely seen quite a handful of dancers who that's been the case, where they've never had any issues previously, and then they'll be like, oh, I took up running like a month ago, and then the problems are sort of developing from that. So just something to have on your radar as well. I hope that was helpful. If you have any questions or want any more clarification on shin splints, or more accurately termed medial tibial stress syndrome, please reach out and let me know. Like I said, I will likely do another podcast episode sometime in the future about compartment syndrome, and specifically anterior compartment syndrome, because this is probably the other common shin issue that we see in dancers, and it sometimes gets termed shin splints as well. But true shin splints is medial tibial stress syndrome. And so hopefully that was helpful and you learned a little bit more about it. And thank you so much for listening. And I hope you have a great rest of your day.